adjunct faculty there for about a decade, and so we were really immersed in infrastructure building. And then after ONC and meaningful use, then we were thinking about health information exchange, a different kind of infrastructure building. And now is the era of social determinants of health. What some people don't like the word determinants, they prefer risk factors because that seems something that you can work with, and determinants is so final sounding. But we will talk about that as we go. I have nothing to disclose. I'm currently a vice president at Academy Health, where I oversee all of our population health work and our information infrastructure work. And I'm very excited to tell you about a new grant that we have from the Kresge Foundation with our colleagues at Stewards of Change. How many of you are familiar with Stewards of Change? So thank you very much. They'll be happy to hear that. Some of you have already been involved. I know that Sequoia Hopkins has hosted meetings. CRISP attended the meetings. People from CDC attended the meetings. So we are really the new kids. We're very much in early stages. We did a soft launch in June at Hopkins. And our mission is really to try to connect the dots that you've already heard about in this room, but not starting from the healthcare side, pushing out to the social agencies, but starting with the social agencies and human services agencies. So we're going to be sharing information about interoperability. We're doing an environmental scan right now about interoperability guidance that's been provided from the feds, and for the Administration for Children and Families has some very nice interoperability guidance, which Hopkins was involved in developing back in 2011, I believe. And we think of ourselves as a community of networks. So we're very much in the opening stages and feel like, as I mentioned, this is an idea whose time has come. So again, we're starting from the social services side and trying to find out who's already connecting. In many cases, the people who are connecting have known each other for 10 years, 15 years. They started sometimes in the Chin movement. I mean, there are some really interesting relationships in this field, and probably a lot of people in the room have been involved in developing some of these initiatives. Stewards of Change is a national nonprofit that has been working on interoperability in the social care side for about 15 years. And Academy Health, you probably know as the Health Services Research membership organization, but we also, about 60% of our budget is working with federal and foundation partners to do convening and basically to generate evidence that can move into policy and practice. The inaugural partners in this initiative are the California Health and Human Services Agency, Silicon Valley Regional Data Trust, which is actually starting with 3 school districts in Santa Clara and San Mateo. They have actually 3 counties, 55 school districts, and they already have set up an equivalent of health information exchange for social data. They're looking at criminal justice, kids who start getting into the system when they're young. It's really, you know, homelessness, all of the social determinants that Bill set up so nicely. So they are really, you're going to hear about them. They have a lot of funding from the Chan Zuckerberg Institute with focus on kids, but I think that a lot of the infrastructure certainly applies to other age groups. Connecticut Department of Social Services is a state-administered program. They have a lot of data analytics. They are in the process of trying to figure out what they can do to predict where to direct resources. That's a very interesting model. In Virginia, what we're going to be looking at is Fairfax County, Arlington County, and the city of Alexandria, which are contiguous, just on the other side of the river. And what they're trying to do is figure out how to have standardized reporting to the state, as well as to be able to exchange information about families and following kids in particular across those geographic jurisdictions. HIMSS, Stewards has had a project with HIMSS looking at water quality in Michigan. There's several other projects that are spinning out, and we've started talking to Sequoia about how to make this partnership a little bit more robust. So what Nick has done so far is to convene people. We did a webinar this week with the SHEIC folks, the Health Information Exchange Association. We are hoping to develop some standardized measures and develop some multi-sector case studies. Again, trying to standardize what the best practices are, what works and what doesn't, because we're not competing with each other. We're trying to figure out what our role, what Nick can do specifically to fill in some of the white space or the gaps in other activities. So why we wanted to do this was because nobody is doing it in the social care space. And there's just a crying need, particularly, I don't want to editorialize too much, but many of us are really concerned about what's going to happen to families at risk in this administration. And so the time has never had more of a sense of urgency in our view. What we're doing is throwing our hat in with the All In network. How many people are familiar with All In? A few. So you heard about DASH before, which is sponsored by the Robert Wood Johnson Foundation. So Academy Health had a grant with the Office of the National Coordinator to be a program office for the Community Health Peer Learning Program, which is very similar to DASH in being local and regional collaboratives to share information and to start reaching out to the social services side. Those two programs decided, hey, we're doing so many similar things, let's hook up somehow. The De Beaumont folks and the Build Initiative came in, a few other initiatives have come in, and now there's a common infrastructure, there's a platform that's open to organizations. They're still working on the membership structure. But this is a good time to follow what's happening with that kind of Uber initiative. Every network that joins can have its own segmented space in the platform, and then you can have access to all the other networks. So it's going to be a peer-to-peer mentoring model, which we're very excited about. And I'm happy to answer questions during the question period or later on, and really appreciate this opportunity to be here today. So thanks very much.
Thank you. I've never had